Chapter 5. He wasn't a spy, just a nice guy. After graduating from university, I was assigned to one of China's top teaching hospitals, a place buzzing with patients, pressure, and possibilities. For a young trainee like me, it was perfect. At the time, we weren't allowed to choose our specialty. Departments were assigned by the hospital's personnel office, based on national needs, not personal preference. I considered myself lucky. I was placed in surgery, my dream. Our surgical training followed a strict system. First, we rotated through outpatient clinics where senior consultants guided us in diagnosis. Then came the wards, where we were fully involved in patient care, from preoperative preparation to surgery and post-operative recovery. Later, we moved to the emergency department, facing real trauma, real urgency, and real decisions. We rotated through all kinds of specialties in surgery: orthopedics, general surgery, neurosurgery, thoracic surgery, each with its own rhythm and drama. Every fourth night, we worked a 24-hour shift, but in reality, it often stretched to 28 hours or more. After covering emergency surgeries through the night, we still had to operate or assist in routine cases the next morning, especially for my own patients. It was exhausting, but that was the discipline of surgical life. No sleep, no excuses. Just your hands, your brain, and the life in front of you. In my first year in general surgery, I did so many operations that even appendectomies alone added up to over 100. At first, my hands trembled, but later it became as familiar as a carpenter's craft: precise, fast, reliable. A patient would come in with pain, and within hours or days, walk out with hope. That's how you become a surgeon, not just through textbooks, but through repetition, pressure, and the will to keep learning. I still remember the first patient I lost, an elderly gentleman over 80. He had lived a long life, but that didn't soften the blow. We did everything right, but we couldn't save him. I went back to the office and sat down. My body was there, but my heart was heavy. It was the first death I had faced with my own hands, and I cried. Minutes later, my colleague, a consultant surgeon, walked in. He saw me and said firmly, "Stop crying. You're a doctor now. You need to go help the next patient." It hit me, not as coldness, but as clarity. I wiped my tears. I stood up. Because yes, I was now a doctor, not just in skill, but in spirit. And being a doctor means showing up again and again, even when your heart is broken. One of my colleagues, a senior anesthetist, once shared her experience with acupuncture for pain control. It left a deep impression on me. She had lived through the Cultural Revolution and told me something I never forgot. During those years, they often used acupuncture for anesthesia, even in major surgeries on the chest and abdomen. "Can you believe it?" she said. "The patients didn't feel pain, even when we opened the chest, and the needles weren't even placed on the chest. They were in the arms and legs." As a Western-trained anesthetist, she couldn't believe her own eyes. We kept asking the patients, "Are you okay? Does it hurt?" But they just said no. They were completely conscious, talking, answering questions, totally awake. It didn't make sense to me. They always had the drugs ready, just in case. The IV line was in place, the medication was drawn. If the patient even hinted at pain, they were ready to switch to chemical anesthesia immediately. But the patient stayed calm, relaxed, and pain-free. I already knew from university that the heart, lung, and stomach meridians run through the limbs and connect directly to internal organs. That's why they placed the needles in the arms and legs, not out of convenience, but based on traditional Chinese medical theory developed over centuries. I was very impressed. Years later, I applied this knowledge in my own clinic in London to help patients manage various types of pain, from post-operative discomfort to abdominal pain and chest tightness, with excellent results. But back then, I was just a young surgeon, still learning how to listen. In the ward, we cared for many breast cancer patients. They were mothers, daughters, sisters, wives, each carrying the quiet fear of losing not just life, but identity. That touched my heart deeply. I saw how illness didn't just affect them physically. A diagnosis could shake their sense of femininity and dignity. And I thought there must be something more I could do, something beyond simply removing a tumor. It planted the first seed of my desire to explore breast reconstruction and integrative care. At the time, I didn't even know who performed such operations. In the west of Beijing, there is a lovely park called Purple Bamboo Park, Sijuyan. By the mid-1980s, one corner of it had become something special, what people called the English corner. Every weekend, young people gathered there to practice speaking English. It was simple, spontaneous, and full of hope. China was just beginning to open its doors to the world, and this little corner felt like a window to something bigger. Foreigners were rare, but curious young people like me gathered there to try a few phrases. My friend, a final-year medical student named Dr. Gay Hong, mentioned it to me, and I thought, why not? I was shy, and my English was almost non-existent, but we went anyway. There, in the crowd, I saw a tall foreigner with brown hair and blue eyes. He was clearly British, speaking fluent English with those around him. I stood far away, listening from the edge. When I finally got close enough, I asked one question. Is medical care in the UK free? He smiled and explained that, yes, citizens in the UK have access to free medical care. I was pleased to hear that. Before I left, he asked, "What do you do?" "I'm a surgeon," I replied. Then he asked, "Do you want to study in the UK?" I smiled again. "I hope so," I said. No one had accepted me. I had nothing but a dream. He said, "I'd like to talk to you again. Where do you work?" I started marking my hospital's location on his map and wrote a note with my name and the hospital address. But after we left, I realized the note was still in my hand. "Too late," I said. "He'll never find us now." Dr. Gehong and I looked at each other and burst out laughing. The next day, I was having a cup of tea with my friend Mr. Li Yongguang, a musician from the Beijing Opera House. We were chatting and laughing about the tall foreigner from the park when, suddenly, I heard a voice outside. English. I froze. Oh, that voice? It's him! I rushed to the window, and there he was, walking past with a Chinese man beside him, helping him ask around. It was unexpected. Our hospital had several buildings, and yet, by some strange luck, he walked right past our window. He was looking for me. Just imagine, if I'd stepped out 1 minute earlier or later, I would have missed him. He stayed with me wherever I went. He only had 2 days left in China. I didn't take him sightseeing. I was still working. But he followed me from place to place, waiting outside while I worked and joining us for dinner. My parents noticed and said, "This man is very kind." But it didn't take long before my hospital found out. The next morning, the head of the surgical department pulled me aside. My boss warned me not to bring foreigners to the hospital. I said, "Okay," just to keep the peace. But I didn't tell John. Why bother? He was only here for 2 days, not plotting a revolution. People still carried the fear of the Cultural Revolution. During those years, ordinary Chinese citizens weren't even allowed to speak to foreigners. Foreigners were seen as spies, enemies, or capitalist agents trying to subvert the government. Just being seen with one could get you into trouble. But I wasn't afraid. I hadn't lived through those persecutions directly. So I replied, "It's fine. He's only here for 2 days. He's just helping me practice English." The head warned me again, "Then don't bring him to the hospital anymore. If you insist on meeting him, it's your responsibility." In other words, if anything political went wrong, even if he turned out to be a spy, the hospital would not take the blame. I nodded, but I still didn't tell John. I continued seeing him. We talked just like before. Nothing changed. He helped me practice English, even though I could barely understand him at the time. I asked what he did in the UK. He said he taught history. Later, I learned his full name, John Roberts, from Sussex. He had been an RAF pilot and later became a university lecturer in politics. He was wise not to mention that in China. Even saying the word politics could cause trouble in those days. Before he left, he offered to find out how I could study medicine in the UK. 2 weeks later, I received a letter from him. Inside was an address, the General Medical Council in London. "Write to this address," he said. Mr. Roberts made me feel that I was good enough to try. He believed in me, and I trusted him, so I decided to try. I sent 9 letters to different hospitals in both the US and the UK, mainly the UK because I loved its long history. One of them was to the General Medical Council in London, the address Mr. Roberts had given me, asking about learning opportunities in breast cancer. One of my patients, a British-Chinese man living in Beijing, saw the envelope and said, No, don't go to London. If you want to study medicine, Edinburgh is the place to go." He believed it had the best medical training in the world. I didn't even know how to spell Edinburgh, so he took the pen from me with great confidence. crossed out London in one bold stroke, and wrote Edinburgh across the envelope. The letter inside? Already sealed, and still addressed to London, using an address kindly given to me by Mr. John Robert from the UK. He had spent a great deal of time helping me. He believed in me, far more than I believed in myself, and he kept his word. He tracked down the address I should write to and sent it to me. I knew I had to try, if only not to let him down. We didn't have the correct postcode for Edinburgh, and for someone like me, finding a UK address was a real challenge. The hospital library had no English books, and the Beijing Central Library, 2 hours away, was closed on weekends. I worked 6 days a week, and even on Sunday mornings, I sometimes had to check on patients who just had surgery the day before. No one had annual leave. Even if I'd made the trip, I wasn't sure I'd find the right information. No computers, no internet, very limited English. Just determination, gratitude, and deep respect for someone's kindness. So I sent it off. Honestly, I didn't expect anything to come of it. It felt like tossing a message in a bottle into the sea, leaving the universe to sort it out. But somehow, despite all the confusion, that envelope made its way to the desk of Professor Sir Patrick Forrest, Britain's leading expert in breast cancer. He read my letter and said, "Ask her to send her university exam results." So I did, and they accepted me. The next problem was how to get there. A ticket to the UK cost more than 3 years of my salary. A dear friend, Thomas, a Singaporean Chinese economist who had graduated in Vancouver and was working in Beijing at the time, stepped forward and offered to pay for the ticket. I never forgot that. Later, when I received my scholarship from the Royal College of Surgeons in Edinburgh, I sent him back double the amount. 滴水之恩，当涌泉相报. When someone gives you a drop of kindness, you repay them with a spring. It took him 6 months to cash the check. He knew I needed to save up for the following year's visa application. But I insisted, because I never take trust for granted. One thing that truly worried me, I told my father before leaving for Britain, was my English. My spoken English was so poor, I could barely understand people. He looked at me and smiled like he always did when I was worried. He was sitting by the window, holding a glass cup of green tea. The tea leaves, real whole leaves, not powder, floated gently in the hot water, slowly unfurling like a garden coming to life. Then he said, "In England, even a beggar can speak English, but knowing English doesn't make you a doctor." I laughed. It was such a father thing to say, plain, honest, and just cheeky enough to make me feel better. He then said, "When you were little, you studied Chairman Mao's writings every single day. You recited them like scripture. If they had made you study English like that, your English would be perfect now." He said it with a bittersweet smile, but behind his words, I could feel the pain of a father who had watched his child waste precious years reciting slogans instead of learning something useful. On the night before I left for London, knowing no one there, and carrying only $160, the most foreign currency a Chinese citizen was legally allowed to bring abroad at the time, I carefully sewed the opening of my pocket shut, afraid of losing it. We couldn't exchange Chinese currency overseas, so I had only $160 in my pocket. My father, a quiet man, said just one thing. "When you're in the UK, no matter how bad things get, you must tell us the truth." He knew I might try to hide bad news to spare him worry, but he needed honesty more than comfort. I couldn't speak, I just nodded, holding back tears. My mother stood silently nearby, wiping her eyes. In that moment, I felt something unshakable. No matter how far I went, for better or worse, in sickness and in health, they would always be with me. End of chapter 5.